My name's Dr. Dan Weathers. Career-wise, I practiced emergency medicine for 30 years and finally left the chaos of that at age 55 7 years ago. Tried retiring for a couple of years and studied art, did metalsmithing, glass blowing. I finally decided to go back into medicine and at age 58 obtained a fellowship in addiction medicine at Case Western Reserve Medical School in Cleveland, Ohio. And went up there and studied addiction for a year, and then I've been for the last 3 years working in the addiction field. And slowly, as I've worked with addiction and alcohol patients, discovered that almost all of my patients have underlying disorders. They're either pain disorders, medical disorders, mood disorders. But as I've begun to take people off of drugs into health and recovery, found that many of them had hormone issues, hypothyroidism, hypogonadism, and began to explore learning more about bioidentical hormones as an addition to our scope of practice. And in the process, now I'm pursuing my third set of board certification in anti-aging regenerative medicine. So this is a fun exploration, and it really goes hand in hand with what I've been doing. For 30 years, I treated diseases in the end stage of lifestyle choices and behaviors, and ultimately end up in a behavioral medicine only to be guided back to the body and what actually is happening in the neurochemistry and in the gut and some of the basis for the different diseases that we've seen and treat. Everybody's got something, and it's just a fascinating journey to learn more about this. Addiction is in fact a neurochemical disorder of the midbrain, a specific circuit called the mesolimbic midbrain, where there's probably in all addicts a dysregulation in dopamine, which is a deficiency state, where people find various forms of chemicals and/or drugs, including nicotine, food, sex, to attempt to replace dopamine that's missing in the midbrain. It's all, with addiction, it's all about dopamine and lack thereof. And there are natural ways to boost dopamine. There are natural ways to enhance that that allow people to feel that missing piece has been replaced and they don't need to seek the addictive behavior. Bioidenticals, especially in the case of opiates, almost all opiate addicts are deficient in testosterone because opiates inhibit hypothalamic GnRH, which inhibits FSH and LH, which have to do with spermatogenesis and testosterone production. So many of these people use opiates for chronic fatigue that's really testosterone based. Traditional medicine teaches us to use the medicines that Big Pharma produces. And they might be the equivalent of using a 45 to kill a fly. In that there are other solutions, oftentimes by enhancing the amino acid precursors and adding the cofactors that have to do with the production of the neurotransmitter. You can create these things naturally without using a major pharmacologic drug that has major toxicities associated with it. I like the concept of looking towards natural solutions first, and failing those, I'd turn to conventional medicine I've used all my life and prescribe for patients. So it's not that I'm going to quit prescribing those medications, but this gives my patients more alternatives in terms of enhancing the neurotransmitters or the hormones with natural remedies that might be quite sufficient in and of themselves. So that's exciting about it because it's more tools in my armamentarium as opposed to getting out the hammer first. You might want to chisel at something. If you'd like to know more about that, which we do, the name of my medical practice is Savannah Avenue Recovery and Health, or SARA, LLC, and we're located on Savannah Avenue in Statesboro, Georgia, and our website is recoveryhealth.org.